Auto-brewery syndrome. A New Jersey teacher named Mark had never had a drinking problem in his life. Then one day, coworkers started noticing he smelled like alcohol at work, even though he hadn't touched a drop. Years later, police pulled him over and tested his blood alcohol level. It came back at 0.18, more than twice the legal limit, despite him swearing he hadn't been drinking. He was facing DUI charges, and nobody believed his explanation, because there wasn't one that made sense. Doctors finally admitted him for testing and discovered something almost impossible. His gut was overrun with excessive yeast, the kind used in brewing, and it was fermenting the carbohydrates he ate directly into ethanol inside his own digestive system. In lab conditions, drinking nothing but a sugary beverage was enough to push his blood alcohol above the legal limit. His body had become a brewery. Only a few dozen cases of this condition have ever been documented, and multiple people have been arrested, lost custody of their children, or lost their jobs before doctors were finally able to prove that their intoxication was coming from inside their own bodies. A worm in her brain. For months, a 64-year-old woman in Australia went to doctors with a strange rotating list of symptoms: abdominal pain, a persistent cough, then depression and memory loss that nobody could connect to anything. An MRI eventually found a lesion inside her brain. During surgery to remove it, the neurosurgeon made a discovery that had never happened in recorded medical history. Still alive and moving inside the tissue was an 8-centimeter roundworm. Her surgeon later said her reaction in the moment was pure disbelief, that it was actually wriggling. The parasite was identified as a species normally found only in carpet pythons, a type of snake native to the area near where the woman lived. Researchers believe she accidentally ate wild greens contaminated with python feces containing microscopic eggs, and over months or years, the parasite migrated all the way into her brain. No human being had ever been diagnosed with this infection before her. Doctors had to scramble afterward to check the rest of her body for any additional larvae, because there was no existing medical playbook for what to do next. Bleeding from the eyes under stress. An 11-year-old boy in India began experiencing something that looked medically impossible. During periods of intense stress, especially around school exams, blood would begin seeping from his eyes, ears, and nose, with no injury, no illness, and no clotting disorder to explain it. When doctors observed him during an active episode, they watched fresh blood emerging directly from his tear ducts while his skin showed no wounds at all. The condition is called hematohidrosis, and it's so rare that doctors still don't fully understand the mechanism behind it. The leading theory is that extreme psychological stress can cause the tiny capillaries around sweat glands to rupture, mixing blood directly into sweat and tears. Historians even point to old legends of warriors sweating blood before battle as possible early descriptions of the same phenomenon. Treatment for the boy focused entirely on calming his nervous system with therapy. Within 3 months, his bleeding had stopped completely. His body had been having a full physical breakdown, and the only cure was treating his mind. A fetus found inside a toddler's brain. A 1-year-old girl's head had started growing at an abnormal rate, and when doctors ran a scan to find out why, they discovered a strange calcified mass sitting inside her brain's ventricles. During surgery to remove it, surgeons realized they weren't looking at a tumor. They were looking at a partially formed twin. The condition is called fetus in fetu, and it happens when an early embryo splits into twins, but one twin stops developing and becomes absorbed into its sibling's body before birth. It's already exceptionally rare, occurring in roughly 1 in every 500,000 births, and it's almost always found in the abdomen. This one had ended up growing inside her brain instead. The arrested twin had shared a blood supply with the girl for her entire life. Surgeons successfully removed it, and follow-up scans showed no lasting damage. The milk sickness of the frontier. In the early 1800s, families across the American frontier began dying in a pattern nobody could explain. It always struck in summer. Victims would grow weak, then vomit, then slip into a coma, often dying within days. Entire households were wiped out while their neighbors stayed completely healthy. Doctors of the era called it the Trimbles and had no idea what was causing it. Entire communities abandoned their farms out of fear, and the state of Kentucky offered a bounty worth over $70,000 in today's money to anyone who could find the cause. Among the dead, over the decades this illness spread, was Abraham Lincoln's own mother. The answer finally came not from a doctor, but from a midwife named Anna Pierce, who noticed that sick cattle in certain pastures had been grazing on a plant called white snake root. Guided by a local Native American woman, she confirmed her theory by feeding the plant to baby goats, which developed identical symptoms within days. The toxin from the plant was passing directly into the milk and meat of cattle, and then into the families drinking it. For decades, an entire toxic ecosystem was hiding inside something as innocent as a glass of milk. The epidemic that put people to sleep forever. Starting in 1916, a mysterious illness began sweeping across Europe and the United States, and to this day, nobody has ever identified what caused it. Hundreds of thousands of previously healthy people began falling into deep sleep-like states that could last for days, or developing violent tremors and rigid, frozen postures. About a third of the acute cases died from respiratory failure as the illness attacked their brain stems. The ones who survived often entered a permanent frozen state, unable to move or speak for years, sometimes decades. Decades later, neurologist Oliver Sacks encountered a ward full of these survivors and gave them an experimental Parkinson's drug. In his book Awakenings, he described what happened next. Patients who had been essentially motionless since the 1920s suddenly opening their eyes and speaking again for the first time in half a century. The epidemic vanished by the 1930s as mysteriously as it had appeared. 500,000 people were affected, and to this day, medicine has no answer for what it actually was. The girl who stopped aging. Brooke Greenberg was born in 1993, and for the next 20 years of her life, her body never grew past the size of a toddler. She never went through puberty, never developed beyond the cognitive level of a small child, and when she died at age 20, the cells in her body still carried the biochemical age of a 5-year-old. Doctors ran every genetic test available and found nothing. After her death, researchers identified 5 other cases worldwide of people who showed the exact same pattern, adult in age, but frozen permanently in early childhood, both physically and mentally. Nobody has ever explained what mechanism could pause human development so completely and so precisely. Scientists still refer to it only as Syndrome X, because there's nothing else to call something that isn't supposed to be possible. If you like this video, drop a comment to share your thoughts and subscribe for similar ones.